So, welcome back, everyone. Been a while since I've made a YouTube video. I wanted to talk about my experience with non-steroidal anti-inflammatories, NSAIDs, and apparently Flexeril and tizanidine in small percentage of patients can experience what I'm going to talk about. But briefly, for a few seconds, like going through all this, like it's brought a lot of, like I've seen a lot of stuff that's happening in the chronic pain community that is just, insane. And I'd like to bring some attention to that. First of all, there's this whole thing. I've got a screenshot here of David Hanscom says that the key to solving chronic pain is learning to quit fighting it, be with it, and let it dissipate. Acceptance and commitment therapy, ACT, is a way to learn to be with uncomfortable feelings and develop psychological flexibility. So, if only it were that easy. That's kind of like telling a depressed person, just perk up. If only it were that easy, Another thing that I did want to talk about that's sort of off topic, but is very relevant, and I will have a link to this in the description if you can access it. I think there is an ad block, but if you go and you search the Kansas City Star, search Kansas City Star, they were denied disability benefits after medical exams in KC. And you might be able to find the article that way without the pay or without the ad block or the ad wall. And I got a screenshot of that here. I tweeted this out myself because this was really cool. And what's going on in it, there's a law firm that's taking the SSA to court, and a medical examination place because they were profiting off of denying disability claims. I think it was something like $168 per patient. In the article, it says something about how, like, there's only a 37 approval rating, like 68% denial rating, which is the lowest disability denial rating in over 30 years. And they caught the organization, the medical place, making up things about people. Like it said, well, we witnessed him turn a doorknob. Well, the problem is the facility doesn't have doorknobs, so that's not possible. So they were actually falsifying information on medical records, fraudulent stuff. So I think that's cool that a law firm is taking them to court over that, saying like, whoa, hey, like this is crazy. There's a lot of people with legitimate disabilities that are being denied disability. Because they're incentivized to deny disability claims. Another thing that is off topic too that I wanted to discuss is something called MAiD, M-A lowercase I and then D. And this is something that is happening in Canada. They have discussed it briefly in the United States. I can try to find the article for that too. I will leave an article to this. I have a screenshot here of it. I'm not going to go over the article, but basically over in Canada. And I actually have another screenshot of what's going on here. We have another disabled person who would otherwise be alive died via MAiD this week due to it being impossible to afford at-home support. It said, ultimately, it was not a genetic disease that took me out. It was a system. Kovac wrote in an obituary to loved ones. A Winnipeg woman who chose to die with medical assistance. Now, this is something that is ultimately very, very disturbing to me is that society is already considering euthanizing chronic pain patients over prescribing them opiate pain medications. I can't rationalize that. I mean, if the argument is, well, we don't want you on pain medications for your own safety and your own benefit, but then they turn around and say, but we'll help you die. It's like, well, that kind of defeats the purpose. It's like, well, can't I just exercise my right to bodily autonomy and have medication? Oh, no, that's harmful for you, but we'll help you die. And they're doing this. It's a real thing. It's actually a legitimate thing. They're doing it in Canada. It's called MAiD. They've discussed it at the Supreme Court level not too long ago here in the States. But they've almost enacted it. They're pretty much almost doing that already. They're killing patients left and right, but I'll get into that in a second. So yeah, that's something that I wanted to bring to people's attention. So another thing that's sort of off topic too, but I still wanted to bring up, just to give you an idea what us chronic pain patients have to go through. Here's a doctor saying, here's a screenshot of it, David Hanscom, stop discussing your pain, medical care, or even any of your troubles with the world now. You are not going to move forward while hanging on to your grievances. Every day is an opportunity to begin anew. So now we're basically being told to sit down and shut up. And some people have said, why don't us chronic pain patients have a 1,000,000-man march? And somebody brought up in a Twitter feed, they said, you want us to have a 1,000,000-man march, when we're scruffling our feet to get to the bathroom or get out of bed. There are many chronic pain patients who are debilitated by chronic pain that are bedbound. I'm not, but it takes me 4 to 6 hours to make coffee, brush my teeth, and take a shower. 4 to 6 hours to do that. I currently don't have any pain medication, and I've only been sleeping 4 to 6 hours a night, usually waking up due to pain. The other thing that I wanted to talk about off subject to my own story was there's this really amazing woman on Twitter that I just... Wait, before I get into that, I do want to say, this is going to go beyond chronic pain patients soon. Here's a screenshot of the first tweet that I saw about this from a very nice pharmacist, I believe, on Twitter, from a NPR article. The FDA has officially declared a shortage of Adderall, to which I responded saying it really wouldn't surprise me if this is going to become a thing, because they're starting to attack psychiatric medications, specifically Ritalin, Adderall, Concerta, and any kind of benzodiazepine. Basically the controlled substances in psychiatric care. And they've already Anna Lemke's already started an ad campaign against benzodiazepines, calling it the next addiction epidemic, which I don't know that there's that many people out there that are addicted to benzodiazepines where it would even have a very strong street value. I don't think it even does. I don't hear of people interested in benzodiazepines very often. It's ridiculous. There's not an epidemic of people addicted to benzodiazepines. It's absolutely absurd. Just my personal experience. I don't have any data to back that up, but that's weird. It's weird. So, and lo and behold, I was correct. Here's a screenshot of this. It says, well, guess what? D says There is no plan to raise manufacturing limits on ADHD medications next year. The agency cited concerns over young adults abusing the drugs. Again, #death goes too far to prevent a few from abusing and disregards patients who need it. And yeah, that's something that the chronic pain community saw. This is how it began, I believe, for the chronic pain community with pain medications, with opiate pain medications, is, suddenly we're running out of stock. Suddenly we're not going to fill this doctor's prescription. They've been blacklisted from this pharmacy. They're starting to do this with psychiatric meds, and it's not just ADHD medication. It's also panic, anxiety, PTSD medication that they're doing it to as well. So that's fun. Now, to this amazing woman who has brought up some absolutely just horrific things that they're doing to us chronic pain patients in the world, and she comes up with like really good data to back it up, built to the brink. Not really sure how to say her name, but I'm not going to show her videos. I don't have permission. I didn't ask her permission to show her videos, but I will leave links to her TikTok to these specific videos. Here's a screenshot from one where it talks in this about how what is this? The epidurals are not FDA approved, and this screenshot in this one, I believe it's based. I'm not a big fan of Dr. Oz, but it's a Dr. Oz episode that talks about, or like some kind. It's a Marine who got a spinal cord stimulator installed and became paralyzed from it. So these epidurals do a lot of damage, and she can back that up really, really well. And actually, I do have some videos here. So here's a quick video of epidural paralysis.
Paralysis.
A woman from Deerfield Beach has been awarded tens of millions of dollars after being left paralyzed.
A routine procedure called an epidural left her in a condition she never could have imagined.
Paralysis.
A woman.
Yeah. Okay. What's interesting about that is you see that woman's hand, how that's actually what my hand does. That's called a contracture. It's actually called Gilead-Summerhand syndrome. It's a condition that develops with my NTOS, neurogenic thoracic outlet syndrome, as well. It's bad. It's not good. It's not good. My strength in my hand is crap. Like, mine isn't that bad. I have to walk around with a cloth in my hand like this all the time to keep my hand from contracting and get it uncontracted and keep it from atrophying. There's also this video. I'm only going to play part of it, and I will leave a link to this video. It's on YouTube. I'll leave a link to it, but I'll play part of it that kind of explains why epidurals are dangerous and why they're not FDA approved. They cause something called spinal arachniditis. So I'll just play a part of that right now. Try to pick the most important part.
Not indicated or approved by the FDA, nor recommended by the manufacturers due to reports of severe adverse events, including the development of arachniditis, have also proven to be disastrous by furthering the progression of the disease. Dr. Antonio Aldretti of the Department of Anesthesiology at the University of Alabama, Birmingham, and director of the Arachniditis Foundation, was recently quoted by ABC News that as many as 10 to 15% of all epidural steroid injections result in dura puncture.
So, the thing that I wanted to talk about, part of my story, is that recently, so I was managing my pain to some level to, like, actually, in order to make this video, I had to sacrifice, because it takes me 4 to 6 hours to make coffee, brush my teeth, and take a shower. I had to sacrifice brushing my teeth and taking a shower in order to make this video. It's been really rough. I don't have anything to treat pain. I'm about to tell you my story why. Along with only sleeping 4 to 6 hours a night due to pain, very, very exhausted, very tired, got a lot of brain fog going on. It's hard to think, it's hard to concentrate. Tired, exhausted, in a lot of pain. I've had several flare-ups. What I was doing to sort of manage TOS symptoms and pain was a combination of 600 milligram ibuprofen, 10 milligram Flexeril, and 4 milligram tizanidine. That's a lot of sedatives at once, considering I also take 2 milligrams of Klonopin a day for my panic and anxiety attacks. You know, that's quite a lot of sedatives. Well, I started waking up in the morning vomiting stomach acid and blood. I thought I was throwing up my coffee, because I would drink coffee and I'd, throw up this brown stuff. Well, one morning I woke up, and before I even drank my coffee, I went to the bathroom and vomited stomach acid, blood, and what I thought was coffee. And apparently it's not coffee, because I didn't even consume coffee yet. So I was like, oh my God. I recognize the non-steroidal anti-inflammatories are known for this, so I was like, I gotta stop taking it. I didn't have any, I went into a flare-up, which is where it gets really bad. A lot of stabbing sensations in the back of my neck, shoulder, punched in the armpit, feel like I've been hit in the elbow and the wrist with a hammer, dull achy pains around my scapula, stabbed in the chest, vertebrae in the neck. The cervical spine felt like it was being crushed like an accordion. I mean, like the pain was a solid 10, and I'm not saying that to be over exaggerative. That's pretty normal. It's pretty common that people with NTOS report pain levels between 8 to 10 on a pretty consistent basis. You can go and look that up. People with NTOS, it's reported quality of life is pretty similar to that of a person with chronic heart failure. So I was having these flare-ups. I went to my primary care physician, explained the situation, stopped taking the non-steroidal anti-inflammatory, and I cannot take tricyclics, SSRIs, or gabapentinoids. The ones that they use to treat neuropathic or nerve pain are usually antidepressants. I can't have antidepressants. They swing me into mania and psychosis. I can't have them. I can't do steroids because they land me in the hospital with a low heart rate and mania and psychosis. They could potentially kill me. And so if opiates been arbitrarily taken off the table, they're not even an option. So when the only thing that's left is the muscle relaxers and non-steroidal anti-inflammatories, doctor came up with the idea of replacing my 600 milligram ibuprofen with 25 milligram meloxicam, which is a different type of non-steroidal anti-inflammatory. And so I started doing that. Well, guess what? I was still waking up in the morning throwing up stomach acid and blood. So I stopped taking the meloxicam too. And then I did some research on the internet and found out that a small percentage of people do experience acid regurgitation with Flexeril and tizanidine. So I stopped taking those as well, and finally stopped waking up in the morning throwing up stomach acid and blood. My stomach is still very, very sensitive. I've had to stop eating spicy food, oily food. Like I have to water down my coffee with so much milk. It's more milk than coffee, but at least I still get my coffee in the morning, I guess. But it's since then it's been like a month now, maybe longer, that I have not had anything at all to treat pain. And I'm just saying, like, going into the doctor and saying I'm throwing up stomach acid and blood, it's almost like they might as well have looked at me and said, she gave me this huge long lecture about how we don't prescribe opiates, that they're bad. This was the funniest thing to me. She said, well, studies show that chronic pain patients on opioid pain management therapy over long-term use, when they're taken off of their pain meds, don't experience any significant improvement in their pain. Basically, what that translates to is when chronic pain patients are taken off of their pain meds, they're still in pain, which is like, no shit. There's not a cure for every condition that exists out there. So, yeah, NTOS is one of them. Like, of course, I haven't been on opiate pain management therapy for years, but, you have people out there with really, really severe chronic pain, debilitating, intractable chronic pain conditions. Yeah, when they're taken off their pain meds, of course they're still in pain. Doesn't matter what kind of medication you're giving them for pain, they're still going to be in pain. That's ridiculous. I couldn't believe that came out of a doctor's mouth, but it was almost like, well, you're vomiting stomach acid and blood, but at least you're not on an opiate, and that's all that matters. Like, excuse me? So it's okay that I'm vomiting stomach acid and blood, just as long as I'm not on an opiate or opioid medication, huh? Okay. So, Bilk to the Brink posted this, and later on she sent back to me that a lot of people have had this problem, and actually a close friend of mine, she had her father rushed into the ICU because of an esophageal rupture due to taking, I think it was aspirin, to manage his post-op pain. And, well, this is common, that these NSAIDs claim lives all the time due to ulcers, esophageal ruptures. There's also renal failure, which is kidney failure. And this is a screenshot from Bilk to the Brink about this. And she said when she posted this, a lot of people have had this happen. They've lost family members due to this using non-steroidal anti-inflammatories. And I did find this cute little video that pretty much explains it to a T, and it's my situation. I'll play it now.
Percocet to get you through this acute post-op period, and I'll see you back in a week. Great, thank you. Your recovery seems to be going well. Yeah, I just have a little bit of remaining pain in the knee. Could I have a refill on the Percocet? You'll have to talk to your primary care doctor about that now that you're out of the post-op period. So you still have some knee pain? The Percocet really helped before. Those aren't good to take long-term. Try some ibuprofen. So I've been having this belly pain and my bowel movements have been black for the last day or two. That's probably an ulcer from the ibuprofen. You shouldn't be taking that. But my doctor suggested it. Stick with Tylenol. Your liver enzymes are elevated now. How much Tylenol are you taking? Anywhere from 500 to 1,000 milligrams, like 6 or 7 times a day? That's too much. You're gonna hurt your liver. Then what should I take? Try a lidocaine patch. Your insurance won't cover this lidocaine patch. It's for my knee pain though. My doctor prescribed it. You can pay for it out of pocket. So my knee is really hurting still. We could try Tylenol or ibuprofen. No, I can't take those. I'll write for a prescription to get you physical therapy. What about until then? Percocet worked before. We don't just give those meds out to anyone who comes in. So what can I take? I'll write you a prescription for physical therapy.
But, okay, yeah, that's basically how it works. I mean, that's what happens. It's almost exactly what happened. But yeah, so they sent me home. I've had multiple flare-ups, and I have absolutely nothing to treat pain that is debilitating, like on the bed, on the couch, screaming in tears. And I don't go to the ER because I don't have health insurance anymore, and that would be ungodly expensive. And they're not going to treat pain anyway. And if you think this doesn't affect you, let me just remind you, I would encourage you, I leave my Twitter information to follow me on Twitter in every video. I think we need more able-bodied people, like people who aren't chronic pain patients. I think this is not divided between a political line. This is universally hated by all chronic pain patients, regardless if they're on the left or the right. It doesn't matter. But we need more non-chronic pain patients, more full able-bodied people aware of this, because I think that's part of the problem, is that full able-bodied people are not aware of what they're putting us chronic pain patients through. And the thing is if you think that you're not going to be affected by this, you have loved ones, you have family that could be. Anybody can become a chronic pain patient. Anybody can become debilitated by chronic pain. Anyone can get these conditions. You're not impervious to it. Probably eventually everyone will, more than likely, most people, not everyone, but most people will become chronic pain patients eventually. Because we grow older, our bodies deteriorate, and they fall apart. And this could affect you and your friends and your family and your loved ones. And so you should, I would suggest that all the full able-bodied people that watch these YouTube videos that I make, I tend to go beyond the bounds of all these other content creators and stuff. They seem to, you go and watch leftist YouTube and it's like, oh, the Republicans are out to get you. You go to right-wing YouTube and it's like, oh, all the leftists are out to get you. Not very many people have brought up, this dilemma with chronic pain, and I wish that they would, because there's leftist arguments to be made for it. I mean, this is a human rights violation. Absolutely is. It's a human right violation. And another thing that that's off topic to my story, but that is very, very scary. And I've got a clip of this here. They are starting to try to use first-gen antipsychotic medications on chronic pain patients, one of which includes Haldol, which can cause Parkinson's disease. These medications aren't even given to psychotic criminals anymore, because the side effects and withdrawals are considered too inhumane to give to criminals that are psychotic. You wouldn't give Haldol or this other drug to Jeffrey Dahmer, but you would give it to chronic pain patients. And they wake up and they're not able to talk or communicate their pain because their brain is swollen. And, you wonder why they can't communicate. Well, that's why. They're still in pain, they just can't communicate it. So, to the full able-bodied people, the non-chronic pain patients, we need more people aware of what's going on. I think that's really a lot of the problem, is a lot of people don't know this is happening or what it means or what they're doing until they become a chronic pain patient themselves, and then they join with the rest of us going, oh my God, they're treating me like a doctor would treat me at Auschwitz or something. And it's like, yeah, we know. We've been trying to tell people this. It's actually really scary. A lot of chronic pain patients have died, not just from suicide, but just from bad medical treatment alone. please follow me on Twitter. Look for these wonderful people like Beverly and IBG Girls, Beverly, Milk to the Brink, Life is Art. She's amazing too. Claudia Morandi is amazing. The things that she has done for the chronic pain community she deserves an award. She's probably gotten the most attention out of anyone. And again, I'll leave Bilk to the Brink's TikTok video links in the description, other things in the description. So again, follow me on Twitter. Find these people. Find disability Twitter, chronic pain Twitter, and look what it is that we're talking about. I mean, seriously, they're considering euthanasia over prescribing pain meds. That could be the future. Start speaking up now before you become one. Just saying, like, share, subscribe, comment, and hit the bell button. Oh, I haven't said hit the bell button on any channel you're subscribed to in a long time. Yeah. I did want to talk about something else, but I think I'll save it for a later video. So, like, share, subscribe, comment. And, yeah, with that, I'm out.